international research trainee program for doctors and medical students doesn't stop here. It is meant for general practitioners, orthopedic surgeons who want to refresh their memory about the various bodily systems.
Kiran sir, what is the parathyroid gland and where it is located?
This is the thyroid gland. Parathyroids are endocrine glands which are located around the thyroid. That is parathyroid glands. How many of them? Usually 4. They can even vary, 4 to 6. And are they always around this place? No. That is very, very important in parathyroid glands, because sometimes somewhere the neck, somewhere in the mediastinum, or just behind or around the sternum they can be located, which means they can be missed. There are instances which I'm going to show you some videos also. They have been missed and the patient has not been cured. These are the parathyroid glands which secrete parathyroid hormone, which controls and regulates the calcium and phosphate levels in the body.
Sir, I have 3 questions for you. First, who gave the term glandular parathyroidea?
Welcome Kirtanasri into our IRT program. Wonderfully asked question. The term glandular parathyroidea was given by Ivor Sandstrom.
Second, who described the term parathyroid glands?
Sir Robert Owen was the first person who described the parathyroid gland. Harald Salvesen was the person who first said there is a relationship between the parathyroid functions and the calcium metabolism. Vasile and Generali Francesco described that tetany developed when parathyroid glands were removed, maybe at that time inadvertently. We never know. So that's how all connected the dots and described the whole picture of the parathyroid homeostasis of calcium and phosphate. Today we are discussing it.
And third, what is the normal calcium and the parathyroid hormone level?
Another good question, Kirtana. Serum calcium and serum phosphate are expressed in millimoles per liter. Remember, PTH is expressed in nanograms per liter. So serum calcium is 2.12 to 2.65 millimoles per liter. That is 2.12 to 2.65 is the range. Serum phosphate is little less, 0.81 to 1.65 millimoles per liter. These units we should always remember. How is the PTH normal level? It is around 15 to 88 nanograms per liter. One should memorize these normal values, because then only in an emergency you don't have to go for the reference range. You don't have time.
Kiran sir, can you also educate us? What are the parathyroid gland's normal functions and dysfunctions?
Shabir has put a very good question. Functions and dysfunctions of parathyroid hormone. Functions: calcium phosphate metabolism, and the secretions can be defective sometimes. Hypoparathyroidism. Why? Is it primary or secondary? Similarly, hyperparathyroidism, more of hormone. Why? Is it primary secretion, over secretion without any reason due to a tumor, adenoma or something, or is it related to our fluctuating calcium? Phosphate again differs. It's not like calcium, but then the end result is the bone gets affected. Bone gets withdrawal of calcium to maintain the circulating calcium.
Sir, can you please tell us what is asymptomatic hyperparathyroidism?
What is its significance and how do you treat that?
What did we say? It's expressed in nanograms per liter, and the normal value is 15 to 88 nanograms per liter. Anything above 88 is hyperparathyroidism. All the patients, will they have symptoms? Maybe, maybe not. What happens if there is asymptomatic hyperparathyroidism? Symptomatic or asymptomatic, when anything is wrong, the damage is taking place. It's like water which is separating the ground and the floor. It keeps on doing its damage, like borderline diabetes, borderline hypothyroidism, borderline anything. We have to observe on frequent levels the levels of calcium and the parathyroid.
What are the symptoms in hyperparathyroidism, sir?
So, is the parathyroid gland similarly tender and palpable as our salivary glands and lymph node in our neck?
Yes, they are tender. They are tender. It is all, see, now I'll tell you some very important thing. Doctors must put their hands and palpate. most of the times, at least some of the cases, you will have tenderness. Make the patient comfortable, examine properly, and investigate properly. Seldom the diagnosis is missed. Fatigue, pain in the neck, maybe having pain, discomfort, dysphagia, erythema, and palpable tenderness in the neck. So many things can be seen. I'll put it in a slide. So how do you treat it? Treat the cause. Treat the cause. Hyperparathyroidism, is primary or is it secondary? First, isolate, identify, and remove. Surgery is the treatment for hyperparathyroidism if it is due to a tumor. Otherwise, if it is due to calcium metabolism alterations and aberrations, we have to correct that.
Sir, endocrines release hormones directly into blood. They do not have any ducts like bile duct or others.
How does a particular hormone know where it should attach and carry on its functions?
Another beautiful question. It's like the hormone is left into the blood. They are chemical signaling that takes place, and it has certain receptors and recognizing agents which carry it to the target organ, where it enters that cell by special procedures. Like we have discussed in vitamin D, there are certain genes at the liver level, at the kidney level, at the cell level, which will arrange it to get attached to certain, like ligands, LIGANDs. They are ion complexes which discharge and facilitate this transcription of the gene so that the function is performed. Now let's see, I'm bringing this coin near my laptop which has a little magnetic field. Hormones also get attached by receptors. I'm just trying to picturize the transcription where this whole procedure is governed and modulated by present for all these procedures to be performed. Here it is a magnetic signaling. There will be chemical signaling. The specific genes giving the desired effect on the bones, on the alimentary canal, gut absorption. Some calcium is absorbed, phosphate is restricted. Similarly in the kidney, and the homeostasis is maintained.
What is the best first step in diagnosing hyperparathyroidism?
The clinical suspicion. The eyes do not see what the mind does not know. When a patient comes, if you don't have a suspicion, element of suspicion, how can you diagnose? Go one by one. It doesn't take much time. If you have a clinical suspicion, if you put your hands and check, and if you do your scans, ultrasound and other things, you will seldom miss. Best first diagnostic step is put your hands on the patient. Clinical examination is number one.
Also, sir, what blood and urine test will you suggest to detect hyperparathyroidism?
I advise my students to pause this video here and understand before going ahead. Hyperparathyroidism, as we understood till now, is of two types, primary and secondary. But there is one more element called tertiary hyperparathyroidism. It is a secondary hyperparathyroidism due to chronic state, results in kidney damage, leads to tertiary hyperparathyroidism. Understood? Now the routine blood tests are the PTH estimation, serum calcium, phosphate, magnesium estimation. Urine tests, because they may have polyuria, foul smelling, and also bloody urine due to the damage to the kidneys. Routinely, we do in a 24 hours urine sample the estimation of calcium that has been excreted to know the level at which the hyperparathyroidism is existent and what is the kind of damage also that is occurring. If warranted, if you require, go for an X-ray of the C-spine. Maybe this whole pain is due to cervical spondylitis, who knows? Or it can be a thyroiditis, who knows? Or any muscle sprain, who knows? All the differential diagnosis. Parathyroid hormones must be included. Ultrasound, CT scans if required, 3D or 4D nowadays it's being done.
Hello sir, so I have a question for you. So one of the parathyroid glands can become hyperactive, leading to the need for a surgical removal. So how does the surgeon determine which specific gland is affected and needs to be removed before the surgery, and how do they pinpoint the exact location and site of the abnormal gland? So essentially the procedure involves the isolated excision of the abnormal parathyroid gland, right?
Sir, What is a polar feeding sign on a radiological investigation?
Look for two things: abnormal radioactive uptake by the gland plus enlarged feeding artery called the polar vessel sign.
Sir, I didn't realize how deep our serial episodes are trying to reach out, not only to medicos, but also to young and senior gender practitioners who need updated knowledge. So can you please show us in your online video of radiology for identification of parathyroid tumor?
Was a teenager in motion until 2 broken bones in 2 years left his family with a medical mystery. Was diagnosed with an enlarged, abnormally functioning parathyroid gland that was leaching calcium from his bones. 2 previous surgeries at another hospital to remove the tiny rice-sized gland in his neck had failed.
This was obviously a very frustrating situation. As a father, I can see that. Your child having broken bones, not getting better. I know that something strange is going on. This is not a routine case. There's something uncommon. The likelihood of a parathyroid gland in an unusual location will be very high.
Advancing beyond traditional nuclear medicine and ultrasound to now 4D CT imaging.
So we do get 3-dimensional imaging, and we get it at 3 distinct time points. Before the infusion of contrast, which is a little IV substance, a little contrast dye placed in the vein, an arterial phase where the parathyroid gland will light up very, very bright because it has a rich blood supply, and then a venous phase where that contrast starts to wash out, and it provides us very accurate 3-dimensional localization of the gland.
Hi, Dr. Jim Norman here. In all these black spots in the head are all salivary glands. Those are normal. We're always going to ignore those. Here you see a butterfly and a parathyroid tumor right behind the thyroid gland. The butterfly is the thyroid, and the parathyroid tumor is the almond right behind the thyroid gland. That's a very typical, usual location of a parathyroid tumor. Again, shoulders and head, we're going to ignore the black spots up here. These are salivary glands. The big butterfly is the thyroid, and here's the patient's parathyroid tumor. It's down in the chest a little bit. Here's the tumor way down here. There's no way you can make an incision in the neck and reach this tumor. Once again, if you don't have a good quality sestamibi scan and you don't realize that this tumor is located down here, you can make a big incision in the neck, operate for hours and hours, you'll never find the tumor. It's not in the neck, it's in the chest.
Sir, may I also know, most of the textbook talk about calcium, phosphate and vitamin D metabolism, and then comes upon the chapter parathyroid hormone. So why did you prefer to educate us with this first?
The regulatory functions, first if you read, in that itself, we read a lot about calcium and phosphate.
Parathyroid hormone secreted by the parathyroid glands behind the thyroid glands, right? And so what the main function of parathyroid glands is to create parathyroid hormone. And what it does is parathyroid hormone in the parathyroid gland itself consists of something called calcium sensing receptors. So these receptors are essentially their main job is to actually see the levels of calcium that's within the bloodstream and accordingly make the parathyroid gland release more calcium. So how it works is it helps in regulating the calcium level within the body. So PTH promotes the activation of vitamin D to its active form, calciferol. So calcium and vitamin D is essential in bone growth and bone strengthening. Similarly, PTH also stimulates osteoclasts in the bones to break down the bone cells and thus release more calcium into the bloodstream. So this helps regulate the amount of calcium in the body. Furthermore, PTH can also increase the amount of reabsorption of calcium from in the kidneys as well. So these are the many ways in which PTH regulates calcium within the body. And the reason why it's very important is one, bone health. Calcium is an essential and major component of bone tissue. It plays a critical role in how bone metabolism works, and there's enough and whether the balance between the bone formation and resorption is maintained, right? Secondly, calcium is very important in regards to muscle contraction, proper nerve functioning as well, because if you don't have enough calcium in the body, you can have numbness, tingling sensation, even cramping as well. And finally, calcium is also a cofactor for blood clotting. So these are the main purposes of having calcium essentially managed within the body.
Thank you, folks. Thank you for your immense, deep participation, and you are the future teachers. And this is the first step. Like I said, knowledge must flow like a river. Bye-bye.
Thank you very much, sir, for all the wisdom you gave us today.
This thyroid parathyroid chart has been drawn from 3 different charts for your benefit. keep on memorizing it.